This is why your rehab is so very important. Having a discectomy and then just going straight back out and doing the fishing in the kayak, like think about what that's doing there, right? In a kayak fishing, you're going to be paddling, you're going to be sat down, then you're going to be sat down with a flat lumbar curve. You're not sat with a neutral spine because you almost certainly don't have the mobility to do that. And then you're going to be rotating left, right, left, right. Like that is the worst thing you could possibly do for a disc injury. And you have to remember the discectomy does not heal it, right? The discectomy just chops away the bit that was there, that was bulging, but you still are left with tissue that needs to heal. It needs time to heal. So kayaking would not be what you're doing to heal. Kayaking would be something you do to test the structure after you've done the rehab. The rehab work needs to be done first, right? It's so important if you're going to have this, right? There's no reason you can't get back to doing that, right? That's very important. But you need to actually do proper rehab. Rehab work starts, with the basic spine control exercises, things like dead bug, marching, bridge. You need to be doing those first. If you need any help with this, check out the link in the bio, backinshapeprogram.com, because we talk about this there. But you need to be doing that to learn spinal control. You should arguably be doing it before you have the surgery as well. That's even better if you can start doing that. That's what we recommend everybody do. Learn spinal control before you have surgery, because that way you get the mistakes out of the way before the surgery rather than after the surgery. Think about this: if you have just given birth, right, and you have a C-section and you've got a bunch of stitches on your core, is it better then, right after having those stitches, you start learning to engage your core and all that kind of stuff, or is it better that you learn that before you had the C-section, so you don't need to get around those early learning mistakes and pull your stitches back out again, right? Think about it like that. When we've had these treatments, these procedures, these surgeries, we are not healed. We are given the opportunity to undergo healing, which takes time. So it's better we make the beginner mistakes before we have them than after. But sometimes you just have to make them after because you've already had the surgery, right? And you didn't learn how to do them before, so you just have to start where you start. But that needs to be done first. Then you build up strength and integrity through your rehab work, and then you can test it with something like kayaking. And I would suggest you don't set up a long trip. Maybe it's a short amount. Maybe if there's somewhere you can emulate that on land, that might be a good idea to try first. And that way you'll find you can test microdose, small amounts of kayaking as you're progressing the rehab work to start to get an idea of how much you can tolerate that kind of thing as you make progress on the back strengthening front. And then you can get back to doing things that you really enjoy, which is the only reason that we stop to bother with back pain, is because it stops us doing the things that we really enjoy.